Mead. How are you today?
Okay.
Good. My name's Anissa. I'm going to be your student nurse today. This is my instructor, Sarah. She's going to be observing me today.
Okay, hi. Hi.
Can you state your first and last name for me?
Sue Mead.
Okay. And what's your date of birth, Sue?
April 22nd, 1995.
Perfect. And what brings you in today?
Oh, I don't know. I haven't been feeling very good. I think I have a bladder infection again.
Oh, okay. Are you finding that you have to go to the bathroom a lot?
Yeah, like every 10 minutes.
Okay.
I'm sorry, Sue. So you always want to make sure you remember to come in.
That's right.
Okay. It's okay. That's why we're here. We're learning. Sorry about that.
Oh, no,
Just want to make
okay.
sure we take our precautions.
Okay, you said you have a frequency of urination.
Mm-hmm.
Yeah. And is it waking you up at night?
Yeah, I haven't been getting much sleep.
Okay. What about pain? Are you experiencing any kind of pain?
Yeah, it burns when I pee and my stomach hurts.
Really? Okay. How about, what does your urine look like?
It's super cloudy and it smells really strong.
Okay. Are you sexually active?
Yes.
Okay. Are you experiencing any kind of discharge?
Not that I've noticed.
All right. Are you concerned about STDs at all?
No, I just got tested recently and it was all negative.
Okay, that's good. Let's see here. I just have some more questions for you. Do you have a history of urinary tract infections?
Yeah, I've been getting them like once a month and I'm not quite sure what I'm doing wrong.
Okay. Any kind of history of urinary tract obstructions?
No, I don't think I've ever had that.
Okay. Any history of kidney infections or kidney stones?
No.
Okay. When was your last menstrual cycle?
I don't know, probably like a month ago.
All right. And are you taking any medications currently?
No.
Okay. What about any allergies to medications?
I think I was told I'm allergic to penicillin, but I'm not sure.
All right. This all looks good. I'll go ahead and make these notes. And Shauna, our other student nurse, is going to be in to do your vitals.
Okay.
Perfect. Great.
Knock, knock. Hi, I'm Shauna. I'm going to be your student nurse today. Can I get your name and date of birth?
Sue Mead, April 22nd, 1995.
Okay, I'm going to have my instructor sit in with us. Her name is Sarah. Is that okay with you?
Yeah, that's fine.
Okay, great. So I'm going to need to take your vitals. I'm going to start out taking your pulse.
Okay.
Okay, your pulse is 70. Your respirations are 16, which is good.
Okay.
Do you have a preference of hand?
This one is fine.
Okay. Alrighty. Okay, your temperature is elevated. It's about 100.7. Okay, your blood pressure is 120/80. And your oxygen is about 98. So I'm going to be doing a urine sample. Have you ever had one of those before?
I think so, yeah.
Okay.
Okay. I can instruct you on that. So Shauna, when you're collecting a UA, you want to always verify first and last name and date of birth on here, which can I have you verify one more time, please?
Sue Mead, April 22nd, 1995.
Perfect. So what you're gonna do with this is you're gonna, it's gonna be in the bathroom. Take it with you in the bathroom, and you're gonna use these to wipe from front to back. Once you're done, You're gonna pee a little bit to the toilet, then the rest goes in here, and just put it on the window behind you, okay? Okay. All right. Sounds good. All right, ladies, so what did you guys find from your assessment today?
Well, after doing her health assessment, health history, and her chief complaint, we found that her subjective findings were frequency in urination, burning during urination, cloudy and odorous urine, nocturia, fatigue, low abdominal pain, and a history of recurring urinary tract infections.
All right, Shauna?
She had a slightly elevated temperature of about 100.6. Her urinalysis came back showing leukocytes and nitrates, which are abnormal findings. I also noticed that her urine was dark, yellow, cloudy, and very odorous.
All right. Well, what would be your nursing diagnosis for this patient, Anissa?
Acute pain related to a possible urinary tract infection, as evidenced by the burning and cloudy and odorous urine.
Okay.
Impaired urinary elimination related to a possible infection as well, evidenced by the frequent urination and getting up at night. Also disturbed sleep pattern related to pain and nocturia, as evidenced by complaining of fatigue. And then hyperthermia related to inflammation of the and irritation of the urinary tract infection, evidenced by the elevated temperature. Also deficit knowledge about the condition, prognosis, and treatment needed to get back related to the lack of resources.
Okay. So what do you ladies think the expected outcome and the plan should be for pursuit?
Well, Sarah, there are a few things that need to be addressed. We already compiled a complete and accurate list of the patient's medication allergies and a form of consent. We already know the level, frequency, location of the described symptoms from the patient, from the urgency to void, for the physician to review. The physician determined that the patient would benefit from pain medication, increased fluid intake, and a prescribed antibiotic. My short-term goals for the patient is that the patient will have absent, diminished, burning, or painful urination. After the pain medication is administered, we expect that the patient will have diminished pain within 1 hour. The patient will have decreased frequency, urgency to void by the end of the day. The patient will have knowledge in regard to the common symptoms, treatment modalities in relation to her current diagnosis by the end of the appointment. The patient will be educated on adequate hygiene, proper fitted clothing, dietary habits, exercise, prolonged physical activity, and the use of medications. My long-term goals for the patient are that the patient will have knowledge in regard to the common symptoms and risk factors in relation to urinary tract infection or related conditions by the next follow-up appointment. Because the physician determined that the patient will benefit from an antibiotic, we expect that the patient will have clear, odorless urine within 1 to 2 weeks after fluids and prescribed antibiotics have been administered.
All right. And Anissa, how would you implement the plan?
Well, we'd start administering the medications as ordered and monitor those effects. Assess for signs and symptoms of urinary tract infections. Assess the amount and frequency and odor, color, and clarity of the urine. Teach the patient about perineal hygiene. Educate the patient on signs and symptoms of urinary tract infections. And encourage the patient to drink 1,500 to 2,000 mils of water each day. And treat the underlying cause as directed and monitor the response. Teach about underlying disease process and treatment, and answer any questions the patient may have.
All right, good job, ladies.
Good afternoon, Sue. How are you doing today?
I think I'm getting better.
Good. It's been about a week since I saw you last.
Yeah.
How are you feeling?
Better.
Good. And how's your abdominal pain?
Not as bad anymore.
Okay, good. On a scale of 1 to 10, what would you rate your pain?
1.
Okay, good. And do you still have burning during urination?
Not anymore. That medication, whatever you guys gave me, really helped.
Oh, good. And are you still voiding frequently?
No.
Okay,
No.
good. And have you been sleeping better?
Yep, like a baby.
Perfect. Okay. And have you noticed any more fevers?
No.
Okay. Perfect. Well, Shauna here is going to take your vitals, and I think we're set.
Okay.
Okay.
Hello again.
Okay, and we're doing your vitals just because we want to make sure that everything's within normal limits, okay?
Okay.
right, 98.2, that is perfect. Your blood pressure is still normal, 120/60. Your oxygen is 98, which is awesome. Your respirations are about 16. Okay.
So now Shauna's gonna do some teaching with you, okay? For the future.
So I just want to take a minute to talk to you a little bit more about urinary tract infections prevention and treatment. So urinary tract infections are actually caused by little bitty microbes, such as bacteria, overcoming your body's defenses in your urinary tract. They can affect your kidney, your bladder, and the tubes that run between them. Some of the causes of the urinary tract infection can be having more than one sexual partner, not using a barrier method, such as a condom when having intercourse, poor personal hygiene, such as wiping from back to front, and not keeping your perineal area dry.
Oh.
Not emptying your bladder completely, and lack of adequate exercise, and even some types of restricting clothing. But urinary tract infections are completely preventable, but it's going to take a little bit of effort on your part to make that happen.
Oh. Well, that's interesting. There's some things I need to change.
So I'm going to send you home today with some paperwork that will better explain some of the things that I talked to you about today. Do you have any questions for me?
No. No questions.
Okay, great. I hope you feel better soon.
Okay. Thank you.
Thank you, Sue.